I am Sandra Lockett, and I work as a compliance specialist in OHA's hospital staffing program. OHA's hospital staffing complaint system is how Oregon's hospital staffing law, including the updates in 2023's House Bill 2697 and 2025's House Bill 3294, are enforced in Oregon. This video explains some common myths about enforcement after hospital staffing complaints are investigated under Oregon's hospital staffing law. Myth. If the same violation appears in multiple complaints and/or reports, OHA will issue a civil monetary penalty for each allegation. For example, failure to adopt a hospital-wide nurse staffing plan on June 2, 2025 appears in 5 complaints for 5 different units, and those complaints end up being bundled into 2 separate investigations. Fact. If the same violation appears in multiple reports, OHA will only issue a civil monetary penalty for the first time that violation is cited. Our hospital staffing complaint investigation reports include footnotes that reference the initial citation of the violation. OHA has created this chart that reflects which violations are counted hospital-wide, which are by unit, and which are counted by individual staff member. The hospital-wide violations are failure to establish a professional technical staffing committee, failure to establish a service staffing committee, and failure to adopt a professional technical service or nurse staffing plan. The violations counted by unit are for failure to comply with an approved staffing plan or failure to comply with the CNA maximum assignment limits. This means that if there are allegations against 2 units on the same date, the hospital would be cited twice if non-compliance is found for both allegations. Violations are counted by the number of staff members who are impacted for 3 types of violations. These are failure to comply with the statutory RN to patient ratio in a unit without an approved nurse staffing plan if that unit has a ratio in ORS 441.765 subsection 2, requiring a nurse staff member to work mandatory overtime, and failure to release a staffing committee member to attend a staffing committee meeting. For more information on the types of violations, see the Update on Types of Violations short. Myth. OHA hasn't finished any investigations or issued any civil penalties. Fact. Between June 1, 2025 and mid-November 2025, OHA finished the investigation of over 1,300 complaints, issued 12 warnings, assessed $43,000 in civil penalties. In addition, hospitals have requested hearings to contest 5 warnings and $208,000 in civil penalties. Because the numbers change weekly, the interactive dashboard on the hospital staffing website reflects the latest investigation numbers, providing the hospitals and the staff with real-time updates of hospital staffing investigation statistics. Myth. The hearing request period begins when the notice is received. Fact. Under Oregon law, the hospital may request a hearing to challenge OHA's determination in a hospital staffing investigation or the sanction for noncompliance. The hearing request period begins on the date the notice is mailed to the hospital administrator and the hospital's registered agent by certified mail. For more information on hearing timelines, see the Enforcement Timeline short or the Anatomy of an Enforcement Notice short. Myth. Once a default order is issued, the hospital has an unlimited amount of time to pay any civil monetary penalties. Fact. This default final order includes the findings from OHA's investigation. It may issue an warning or require the hospital to pay civil monetary penalties. If penalties are imposed, the hospital has 10 days from the date the final order is issued to make payment. OHA can take additional actions to collect monies owed if the hospital does not pay civil monetary penalties that have been ordered. For more information about the hospital staffing requirements and the hospital staffing resources, such as FAQs, webinars, and hospital staffing shorts, visit the hospital staffing website at www.healthoregon.org/hospital staffing.